AFLP stands for acute fatty liver of pregnancy, and to diagnose it we have the Swansea criteria, which has some of the clinical features, some of the lab parameters, then ultrasound features, and last the histopath. So in clinical features we have vomiting, abdominal pain, encephalopathy, polyuria and polydipsia. Lab features are bilirubin more than 0.8 mg per dl, glucose less than 72 mg per dl, that is hypoglycemia, which is an extremely important telltale sign which distinguishes AFLP from other jaundice in pregnancy conditions. WBC more than 11,000, AST or ALT more than 42, AKI or creat more than 1.7 mg per dl, ammonia more than 47, coagulopathy or PT more than 14 seconds, urea more than 340. Ultrasound should show ascites or echogenic liver. Histological features are microvesicular steatosis. Remember that if any 6 of these are present, then it is diagnostic for AFLP. Remember that histopath, that is biopsy, is a very invasive procedure, and in a patient with AFLP who already has deranged coagulation parameter, it is very unsafe to do histopath, and we usually do not do, although it is the gold standard for a confirmation of the diagnosis, but it is usually diagnosed with clinical and lab parameters. Now, just to tell you in brief about the AFLP, as I told, it is the acute fatty liver of pregnancy. So it's also so basically what happens in this condition, there is the fetus who is homozygous for LCHAT enzyme, that is long chain hydroxyacyl CoA dehydrogenase enzyme deficiency, and the mother who is usually carrying this homozygous deficient fetus is usually heterozygous. So fetus is homozygous for the enzyme deficiency, and mother is heterozygous for this enzyme deficiency. This enzyme is very important for the fatty acid oxidation in the mitochondria. So when there is deficiency in the fetus, it starts accumulating these fatty acids, which in turn goes into the maternal circulation, and that in turn causes accumulation of these toxic fatty acids in the mother, thereby getting it deposited in the liver, in the kidney, in the endothelial cells, thereby causing these changes and derangements in the LFT, RFT and in the coagulation profile. The closest differential diagnosis of AFLP is HELP syndrome. It can also be very confusing or may be associated in fact with preeclampsia.